Buenas tardes or buenos días. I'm Patricia Redondo, and I have the good fortune of presiding at today's plenary. This is our fourth and last day of our AAHHE virtual conference. So thank you for joining us this morning, this afternoon. And as we proceed to have our fourth plenary, as well as awards, as well as a special closing event. I'll just make one observation about the conference, besides the fact that it's been fabulous, and I want to thank the conference presenters who are on with us. David is right there, and don't know if your co-partner is also with us, but we've had a really wonderful 3 days as well. To thank AMC stores who are working with us and doing all of the background, just to call them out as we are at our fourth day. And just a personal note, I went to the poetry slam session yesterday, and it was one of the best poetry sessions that I've attended. So we have a lot of talent in AAHHE, and I just recommend that for future conferences or some other events that we do. So stay tuned for that. So I want to continue with the introductions now, Lindy's. This is moving forward with the conference. We've had the opportunity each day. Go to the next one, please, to bring land acknowledgements. And this was the land acknowledgement from the first day. And each day we've had each presenter actually at the plenaries bring a land acknowledgement from their particular location. This one is more general. It's from the book, The Warrior Pathway, a production of Division 45 of the American Psych Association. And in brief, it says, we acknowledge the first peoples of our countries as the custodians and occupants of the traditional lands where we live, work, and recreate. We pay our respects to the elders past, present, the 7 generations yet to come, and to their continued connections to the land and community. Thank you. I'd like to move to the next slide, please, which is my opportunity to introduce my colleague and friend, Tomas Leal, a newer member of the board of directors of AAHHE, and a wonderful contributor, as I'll mention, not only to AAHHE, but also to the work in higher education and in the private sector. Tomas is an experienced change strategist and a diversity, equity, and inclusion practitioner and consultant. He works and has worked across many organizations to support workforce diversity initiatives, both globally and domestically. His focus is on diverse global talent management, DE&I coaching, and inclusion strategies. His experiences are across industries, and he's worked in North America, Latin America, Europe, the Middle East, and Asia. Early in his career, Tomas worked in student affairs and student life at several U.S. universities. His degrees are from the University of Texas at Austin and Indiana University in Bloomington, Indiana. That wouldn't come out, Tomas, sorry. Tomas is also living in Philadelphia. So we're everywhere with his life partner, Jose, and Tomas is fluent in English and Spanish. Also to note that for the board, Tomas brought his great facilitation skills to the graduate student task force. And Tomas pulled together a committee, worked with that committee for about 3 months, and we're eternally grateful to Tomas for his work. So with that, bienvenido, Tomas. The mic is yours.
Gracias. Thank you, Patricia, for that kind introduction. As has been the custom at our conference, I want to start with a land acknowledgement. And as Patricia spoke about, is really an indigenous cultural practice of protocol, acknowledging and appreciating that one is on the land of another, right? It's a way of expressing our gratitude and honor to the indigenous people who have lived and worked on the land historically and presently. Philadelphia sits on the land of the Lenape peoples. They were hunters, fisher people, and cultivated the area around Philadelphia along the banks of the now called Delaware and Schuylkill rivers, which is where Center City, the downtown area of Philadelphia, sits. I also connected this land acknowledgement to the human rights struggles of the indigenous communities, that started with the colonization of the land that we sit on. And I was relating it to our topic today, which is really impacting not only our Black, Brown, and Asian communities, but definitely our indigenous communities as well. COVID-19, its impact on our community and academia, which is the topic today, to me really relates to the struggles of marginalized communities all over not only this country, but globally. So I was kind of making that connection personally, not only to acknowledge the land, right, that we sit on, but also to make the connection to our session today. It's my pleasure to introduce to you two of the speakers today, our presenters. Having read their bios, I'm struck by not only the scholarly work that both of these brilliant women have undertaken, but also the way that they've put their work, their research into practice. So in the Fielding Graduate University language, they are truly scholar practitioners. So I'll start with Dr. Amelie Ramirez. Dr. Ramirez is an internationally recognized health disparities researcher at the University of Texas Health San Antonio, where she is chair and professor of population health sciences and director of the Institute for Health Promotion Research. She has 30 years of experience conducting behavioral and communications projects to reduce cancer, increase screening rates and clinical trial participation, prove the efficacy of patient navigation for cancer patients, prevent tobacco use, and improve healthy lifestyles among US Latinos. Dr. Ramirez currently directs the Salud America National Multimedia Program to empower its vast network of 300,000 community leaders to drive healthy policy and system changes to promote health, equity, and support for Latino families. Dr. Ramirez also conducts breast cancer disparities research on quality of life and survivorship issues, and directs QuitText, a bilingual tobacco cessation service for young Latino adults using mobile phone text messages. The service yielded a strong 21% quit rate among enrollees as follow-up. She also has trained and mentored 250 plus Latinos in health fields, and leads the Éxito training program to help master's level students and professionals pursue a doctoral degree and research career focused on Latino cancer. Dr. Ramirez is a Susan G. Komen Scholar and a member of the National Advisory Council on Minority Health and Health Disparities of the National Institute of Minority Health and Health Disparities. Her recognitions include 2007 election to the National Academy of Medicine, 2011 White House Champion of Change, 2014 AAHHE Everett M. Rogers Public Health Communication Award, 2018 Icons in Healthcare Award from Centro Med, and the 2019 Lifetime Achievement Award from the Society of Behavioral Medicine. In Texas, Dr. Ramirez is on the San Antonio Mayor's Fitness Council and is president of the Academy of Medicine, Engineering, and Science of Texas. Dr. Ramirez is a native of Laredo, Texas, earned her Master's of Public Health and Doctor of Public Health degrees from UT Health Science Center at the Houston School of Public Health. So join me in welcoming Dr. Ramirez. I also want to take the opportunity then to introduce Dr. Maggie Rivas-Rodriguez. Dr. Rivas-Rodriguez is a professor of journalism and media at the University of Texas at Austin, as well as the founder and director of the Vosis Oral History Center, the premier oral history and photo archive centered on the Latina experience in the US since its inception in 1999. Vosis has recorded interviews, mostly on video, with over 1,300 Latinos and Latinas of the World War II, Korean War, and Vietnam War generations throughout the country. It includes a collection of Latino political and civic engagement and one on professions. In the summer of 2020, Vosis spearheaded Voices of a Pandemic, a partnership of 15 institutions across the country working together to document and research the effects of COVID-19 on Latinos and Latinas in the US. The Vosis Project produces the annual US Latina and Latino Oral History Journal, which promotes original research and features community public history efforts and a spotlight on an oral history practitioner who has made substantial contributions to the field. Vosis also holds the Vosis Oral History Summer Institute for faculty and graduate students wishing to incorporate the discipline of their research and teaching. Vosis had produced 5 books, provided the basis for plays, developed educational materials, created photo exhibits, and become a resource for scholars, documentary film producers, and others looking for photographs and interviews with Latinos of the World War II era and beyond. Dr. Rivas-Rodriguez worked as a journalist for more than 17 years at major market news outlets, including the Boston Globe, United Press International, WFAA TV in Dallas, and the Dallas Morning News. She was on the committee that created the National Association of Hispanic Journalists and served on its board. Since her years as a college student, Dr. Rivas Rodriguez has been involved in developing and participating in programs to increase diversity in American newsrooms. She earned her doctorate from the University of North Carolina at Chapel Hill, her master's from Columbia University's Graduate School of Journalism, and her bachelor's in journalism from the University of Texas at Austin. On a personal note, Maggie and I, Dr. Rivas Rodriguez and I, have been friends since we were students at the University of Texas in Austin as undergrads at that time. So again, join me in welcoming Maggie Rivas Rivera. Thank you very much. Yes. So I wanted to just get started then with our speakers. So we're going to start with Dr. Ramirez. Dr. Ramirez, do you have slides you want to upload, or?
I do, if I can share that.
Sure, yes, you have co-host privileges, yes.
Okay. It says you cannot start the screen while other participant is sharing.
Oh, yeah. Patricia, I think, or whoever, there you go. Now you can do it.
Okay.
We forgot that part. Sorry.
Great. Thank you so much, Dr. Leal. It's a pleasure to be here with everybody. So, okay, can you see my slides?
Yes. Yes.
Okay. Thank you. Well, thank you for the opportunity to be with this distinguished panel. It's really a pleasure. I want to thank Dr. Joanne Canales for all her work, and Dr. Patricia Redondo as well for the invitation. And it's a pleasure to give you all some information on how COVID is really impacting our Latino community and how we need to work together and to share this information and to create change. And it's a pleasure to also be with Dr. Rivas and her work. I'm very familiar with what you've done with the military group as well. What you had mentioned, Dr. Leal, Salud America. Salud America is a new platform that we have developed with support from the Robert Wood Johnson Foundation to really allow us to communicate to the Latino community across the US. And it's designed to really inspire community change. And we do this by developing culturally relevant blogs and infographics and tweet chats and podcasts in sharing the information that we learn with our communities across the United States. And we keep track of all that we're doing. But when we started talking to our community about COVID-19, we became an information site for our media to really follow what is happening to our community as they've been affected by COVID-19. And I just wanted to share a few facts with you that our Latino community is 2 times more likely than our non-Hispanic white community to be impacted by COVID, and 3 times more likely to be hospitalized. And we know the reasons why, right? Many of our community members are the frontline workers that, that have hourly jobs, that are in our grocery stores, that are in our hospitals and in different locations that are putting them at risk. And what we found is that we also had higher rates of death in terms of the different populations where we're distributed throughout the US. For example, here in Texas, we represent 39% of the state's population, but over 45% of the deaths were in Latinos. And the same as you'll see in California and in Florida. So this, again, this has been a major impact on our Latino community, and some have reported that we've lost a generation of Latinos. Another important fact that is our life expectancy has been shortened. Overall, we see about 3 years of life lost among Black men, but among Hispanic men, it's about 2.4. For African-American women, about 2.3 years, and for Latinas, 1.1 years. And even though we have had the benefit of, as you can see here in the age ranges, living longer, what's happening a lot with our Latino community is that they're living longer, but their quality of life has been impacted by a number of other chronic diseases as well. So when COVID came, if you were at higher risk for having obesity or diabetes, again, this increased your risk for not being able to survive the COVID-19. And so what this shined a light to us is that we need to do more. We need to look at ways that we can improve the health of our community. And we found these 4 major areas that we needed to focus on. Is 1, how can we work together to increase the income of our individuals who are on the frontline workers? And how can we reduce poverty? How can we help improve the working conditions for our agricultural workers and our immigrants population? And most of all, how can we begin to tackle the systemic racism and discrimination that we see in a lot of our different organizations? And last but not least, let not COVID just be a disaster that has happened and that we all forget about it, but what can we do to help ensure health equity as a part of the recovery? And we're hoping with the new administration that we're going to see that, but it's very easy to have another crisis come and we forget what we have just seen. So this is something that's truly important for us. And so I wanted just to pick a couple of these areas to share with you about what Salud America is trying to do. We're really trying to address the gaps of what the virus has caused, particularly among our immigrant population. We were also out there prior to the election to really encouraging people to be counted in our census and really providing information to our communities of why they needed to be out there to vote so that we can increase more equity opportunities. And last but not least is that we really wanted to take away the shame of being impacted by the virus and saying it's not the person, but it's the virus that's the enemy. And so again, how we crafted that information was really critical in our communities. And the other area is the importance of tackling systemic racism. So what we've done is we've actually put together what we call our action packs that are available for community leaders and anyone who would like to actually download this information and use it in their communities. We asked, and it was a 3-step approach for this toolkit, where you could ask your city councilman to put declaring racism as a public health crisis and to create make a commitment to action so that they wouldn't forget about this. We helped design emails that our community members could utilize so that it would be easier for them to facilitate their communications. And lastly, how to really get that community support around this particular city resolution. And San Antonio was able to really put this as a major issue for them. And our mayor is going to had a task force now to begin addressing, racism in public health. And then the fourth element in terms of our recovery is, again, the importance of, in all our communities, asking for community task forces to stay on task with this and to get us beyond COVID, to get us at a healthy point, but also ensuring health equity, and that we need to get more involved with civic engagement and to talk about these different types of changes that are needed. And most of all, we're finding that we need to be involved at all levels in our community planning. For example, we know that transportation is a major issue for our Latino community, and we found that the redlining that's been going on in our community sometimes doesn't allow the bus routes that our frontline workers need to get to and from work in a safe way. So again, these are just different levels of information that we have on our website that we hope that people will download and encourage your communities to utilize. And an ongoing challenge now that we have vaccines available is that there's a lot of hesitancy going on in our community. Our community doesn't want to get vaccinated. There's a lot of misinformation and disinformation that is out there. And so again, this map just shows where the rate of our populations, but the number of individuals who have been vaccinated in these different communities. So hopefully with the new rollout of the Johnson & Johnson vaccine, that there'll be more access to the vaccine. But again, we hope that you will work with us to convince our community members to really get the vaccine so that we can all get back to normal. And some of the things that we have found is that 66% of our Latinos do not believe the vaccine is safe. So we need to make sure that when we create our messaging to our communities, to talk about the importance of the science behind the messaging, that this vaccine has been under development for a long time. Its researchers have known that these viruses were going to be impacting us, but so it's based on credible research information. So we need to make sure that our messaging is clear and accessible to all, that we also are aware of the distrust that our community has. We know that there are times that our communities have not been credible and transparent with them, and that there's been some cultural biases in the past, but we hope that with this vaccine that we can all come together and communicate in an effective way, and to involve our community leaders. So if you've been vaccinated and if you want to tell your story, I think it's really important to say why you're wanting to do this. So we have a lot of things to improve in terms of prior historical trauma, but this is one thing that we really need to get on target. We really need to get our kids back in school, but most of all, that everybody will be safe. So please encourage the use of the vaccine. And our Salud America program also created a campaign that was called Juntos, Stop COVID, which featured bilingual information with culturally relevant facts and infographics and video stories that individuals could download and utilize in their community. And we've just had a tremendous amount of individuals who have been using this information. A special thanks to my team. They've really been at this, as I'm sure most of you have. We're Zooming 7 to 7 these days, but it was really important for us to get this information out. So again, mil gracias. It's a pleasure to be here with you all this morning. Gracias.
Thank you, Dr. Ramirez. So we have we want to have we will have the opportunity to ask questions. So I'm wondering, I think we will now go to Dr. Rivas-Ramirez's presentation, and then at the end Rivas-Rodriguez. Sorry, Maggie, I should just call you Maggie. So anyway, so we can go to Maggie's presentation, and then after that we will have time for Q&A and some comments. So take it away, Maggie.
Thank you, Tomas. It is very funny because I've known Tomas for so many years. I know that I know he knows my name, but it's been hyphenated in the last over the last 20 27 years. So that's a new, the hyphenation is a new one. I'm delighted to be here, and I'm especially delighted to be with Dr. Ramirez because we have another connection. Her cousin Jorge Haynes is a very, very dear friend of mine. So I've been hearing about your work and following Salud America for a long time. And in fact, I used some of you all's material in some of the presentations I've done in the past, because you all have been doing such a phenomenal job of keeping up with the health disparities for Latinos. So I'm going to talk today about Voices of a Pandemic. And this is an initiative that actually is a year old this month. When the pandemic struck in March of a year ago, I really was pretty ignorant, and I had no idea that it would have the implications that it did have. So, but when things started shutting down, it became very obvious to me that we needed to do something. So the Vosis Oral History Center is the oral history work that I worked on and began in 1999. It originally was focused on the Latina World War II experience. And as everybody here probably knows, that was a generation that really did launch a lot of the civil rights advancements that we have enjoyed. So our work, and Tomas mentioned this earlier, we do work in all three areas that are important in higher education and research. We have a journal, we have books, and we're doing research now. And in fact, our research right now is mostly concentrated on the pandemic. We do teaching. I teach an oral history class, and we do a summer institute, and we do service. And the service includes getting the word out and holding symposia and letting people know what the findings are that we're getting. So what is Voices of a Pandemic? It's a partnership of institutions. When I realized that our oral history center at UT Austin is very small, and there was no way that we could possibly do all of the interviews that are required. Everybody who's in this webinar right now has been affected by the pandemic. And we could do an interview with each and every one of you about how it's changed your lives. We are all doing things today related to the pandemic that we never dreamed we were going to have to do. So we understood the magnitude of it. And while most of our interviews in the past have been looking at people who and their experiences during World War II, the Korean War, or different aspects of of civil rights, we felt that we needed to document this as it was happening, because it was so huge that there's no way that we could just ignore it. So we reached out to a few universities, people that we knew, professors that I knew at different universities and other institutions. And so because Vosis has been doing this for so long, we have a really, really solid workflow and protocol. We moved everything online and spent quite a lot of money doing it, so that a big fat pre-interview form that we have been using for years, it's about 27 pages long. It's a pain in the neck to fill out, but when you're doing research, you really appreciate getting some of that information at your fingertips. We moved that online. And so it's now a Qualtrics survey, and then that is exported directly into our database. I know this is a lot more into the weeds than you want to know. However, what I'm trying to say is that we make all of our protocols and all of our materials available to our partners. They own the interviews, but we get to use it on our YouTube channel, and we get to process the interviews. And we do a lot of, and you'll see, we do a lot of work. And we do this for free because we know how to do it. And I also know from talking to our university partners that they may have been wanting to do oral history for a long time, but it's so hard to just get started. And if you are missing one part of the technology or the know-how or developing this, we know that it's going to be really hard for you to start up. So we share that with them. Here's where our interviews have been conducted. As you see, it's all over the country and in Puerto Rico. And we continue. We're working on that as well. this is where we are by state. 26% of our interviews are in Texas, as you'd expect, but it's really all over the country. And I think we've actually added a couple more. I'm going to give you just a glimpse of some of the interviews that we've done. The interviewers are people that most of them are folks at these different institutions, different universities. Here at UT Austin, we have a small cadre of interns, undergraduate interns who did pretty well in my oral history classes that then I say, hey, come work for me, and some graduate students. So this is one with a farm worker that we're really happy to get this interview with. Jose Martinez, 64 years old, works at a mushroom plant or cultivating system in Washington State. And he was just, my student actually got this interview. So let me see if I can do this.
Mentalmente, como todo, me afectó mucho también a mí, porque aunque sea yo y mi hijo nomás, que yo soy el que asumo la responsabilidad de todos los pagos, a veces es duro. Y cuando uno se enferma, desgraciadamente se atrasan de alguna forma u otra en los biles que no lo esperan a uno todo el tiempo, están cayendo y cayendo.
So I felt like his perspective was so important because it's one of the voices that we really have been striving to get, is the voices of those essential workers, and particularly people in the food services who are either in cultivation jobs or in meat packing, meat processing plants. And those are the people that are really so vulnerable to the pandemic. So we've been wanting to get them. And what he speaks to is that other cost. It's not just having the disease, and he was out of work for a couple of months, but also during those 2 months, he had no income. And it's the so many different stressors on people. It's just amazing. This is another woman who we interviewed. She's in Brooklyn, and her husband was on a ventilator, one of the record amounts of time that he was on a ventilator, for 57 days. So those of you who don't speak Spanish, what Jose Martinez just said was that he was worried because he's the one who takes care of the household and pays the bills, and he and his son were both sick, and so during that time he was worried about paying his bills as well as his health. Yasmin Virola was also got COVID, but her husband was much worse affected. And her, I'm gonna just play.
No one could come over. I couldn't go to no one's house. I would come home and lay on my sofa. I refused to go to my room. I didn't go back to my room until my husband got up from the ventilator. So for the first 2 months, I didn't sleep in my bed. I felt like he's there suffering. Why should I be comfortable laying on my bed while my husband's in the hospital suffering?
And I think that to me is kind of one of the larger issues is when you have a loved one in the hospital, when you have a loved one who's suffering, the emotional toll that it takes on the family members who are back home. I'm not going to play a whole lot more of some of the audio, but this is I want to make sure that we have time for questions. But this is someone I interviewed. He goes by Steve Alvarado. His father died of COVID. His mother and he also contracted COVID. And he's a high school principal. And as it turns out, he was in the news because when he contracted COVID back in April, there was a news story. His principal inadvertently released his name to the news media, and then he was in a news program in the San Antonio news television station. But his father died of COVID, and one reason that he was willing to talk to us was because he said,
they used to make fun of me.
I'm not gonna. I think I've skipped over that one. Let me hang on one second.
A lot of us were fortunate.
Okay, this is his father here. His father was Juan Fierros Alvarado. He died. His big role in life was he played baseball. He coached baseball. He had 4 sons. He was married for 53 years. And Steve Alvarado spent a lot of his time during the interview talking about his father because he wanted us to understand that he was more than a number. He was so tired of seeing all the stories about how Latinos have been overrepresented, and it seemed like we were just numbers, and he wanted to make sure that his father's story got told. I'm going to skip over some of the, well, I'll just go with this. Okay, so I'm not going to play his audio, but he was the first Latino dean at this college in Waukegan, Illinois, which I had no idea about this, but it's predominantly Hispanic. And at his campus, they didn't want to shut it down because the president of his campus was worried about where would the people going to go? Where were the students going to go? They had no other place where they could get internet. And so it really shined a different light on an issue of why not just shut down campuses? And he brought up some good points about why they didn't shut down campuses. So here's some of the other factors that have happened in the middle of all of our interviews. So here in Texas, as you know, we have our state government has now said that we're not going to be mandated to wear masks in public. So there's that turmoil, that the difference of now the federal government and the local government and the state government and how they view this. And it's created more stress on people. As I had said earlier, Amelie talked about how her organization is providing services that they hadn't provided before. They're doing things they hadn't provided before. Almost every nonprofit that I'm aware of is kind of doing the same thing. A lot of nonprofits have shifted to doing direct services for people. Over and over, we hear that. And it's just people's responses trying to figure out how can they serve their population in ways that the population needs at this critical time. Of course, it's the exposure of social inequities. It's the issue of Black Lives Matter after the murder of George Floyd in Minneapolis. Latinos were caught up in the protests as well, and it remains an issue. It's how we participated in elections this last time. Here we were during a pandemic, and I know that everybody must have voted themselves. And when you go to vote, everybody's wearing a mask. And it was so heartening to see our people going to vote, even though they were worried about their own health, but they were also worried about the larger health of, social health, our whole country and our community's health. And now we're worried about the vaccine roulette and how people are being able to access or not access, vaccines. So if you want more information about what we do, go to vocesofapandemic.org. If you're interested in becoming a partner, I can show you what we have. It's a pretty standard procedure that we go through. We do have a summer institute. It's going to probably be online this summer, but it'll be in June. And it's a week long. It's excellent. We bring in the best minds because ours is a working institute. Because we're doing the work, it's ongoing. We're very sympathetic and understanding of where everybody is coming from and meeting people where they are. And we do have our oral history journal. This photograph is taken of a mariachi in San Antonio. Our last major interview section was in San Antonio called Voices of a Pandemic. So little did we know that by the following weekend, this was March the 8th, the following weekend, we were starting to shut everything down. So thank you all for your time. Appreciate it.
Tomas, you have to unmic for the interview, for the questions and comments. If you have them.
I lost the mute button somewhere, but anyway. Happy fingers. So this is great. Thank you very much, both Dr. Ramirez and Dr. Rivas-Rodriguez. We have a question in the chat box, and it's Joanne. Do you wanna ask it? I think it was from Dr. Canales. Is that correct?
Well, yes, I'll jump in and ask it. So thank you both for your very informative sharing of information. So as I listened to both of you, I was struck by obviously the need to continue to do the kind of work that needs to be done. And because there are so many nonprofit organizations that deal with unrepresented groups, I was wondering if there's a way to create a synergistic initiative so that everybody's not doing their own thing with their own small group, but that there can be this scaled up massive initiative to really reach the populations that we need to reach, to inform them, to get them vaccinated, so that we can all move on with our lives. And so, Amelie, I know you've been working a lot with the city of San Antonio. Is there some model that's being discussed that other communities could emulate?
Thank you very much for that question, Dr. Canales. There's two levels right now. There's a lot of kind of going on at the local level, but there's also an organization called CEAL, C-E-A-L. It's called Communities for Engagement for Fighting COVID, and it's funded by the NIH. So these 11 states have been funded, and each one of them have multiple organizations that are working with them in getting the information out. So it was a mobilization. It had a couple of objectives. The first was to make sure that our communities are represented in clinical trials. Clinical trials mean the testing of the vaccine that's going to work on all racial and ethnic groups. And sometimes these trials are held in China or held in other places and not necessarily representative of all our diverse populations. So part of the messaging was to make sure that if there was a trial going on in your community, to encourage our communities to participate. And then second is now really focusing on the vaccine, because as I mentioned, you know, there's a lot of misinformation, for example, that there's metal in the vaccine and that they're going to trace you once you get it, you know, these kinds of things, and that's totally incorrect. The anti-vacciners who are out there have their own messaging going out, and they're a very wealthy organization, so that we really need to get out in front of this. And so this organization, SEAL, Community Engagement Alliance, is working together on making sure that our messaging is credible, making sure that our messaging can be trusted, and they're doing different types of webinars and formats to bring people to the forefront. And it's hard, right? Because of the pandemic situation, everything right now is virtual. And so we have to be very cognizant that a large portion of our community is still being left out because we've had to go to this virtual format. But Latinos are kind of the highest users of cell phones. And so we just need to be innovative in how we reach them and invite them to participate. And also through Salud America, we have a number of organizations that join us in our Twittering message, so that the comprehensive message is being sent out to these different connections that each of those organizations have.
So as you mentioned that, I'm struck by two things. One is that these communities continue to go to church. And so reaching them through their pastors and priests might be one avenue, but the other one is the radio station. And I mention that because I am now living in San Miguel, as many of you know, and there is this local radio station that is not just local. It reaches the entire population of San Miguelenses across the country, across the US, who have left. And they're still connected, and they call in and they reach their families that way. I mean, that might be another incredible avenue to try and reach our population.
Right. No, and many of those avenues are being utilized. But again, as you said, we all have to give the same message so that it's reinforced over and over again. Reinforced, you know, from the media, but also from a community. We use promotoras, you know, so that we do in kind of small settings. They're still allowed, you know, with masking and keeping social distancing. They are still doing some of their outreach work. But again, we're also want to keep our members safe as well. And so it's a combination of that. And it's interesting that you brought in the faith-based organizations. There are some groups within the faith-based organization that think the vaccine was made with embryonic fluid or tissue. And so they don't want to take the vaccine. So again, choosing our spokespersons, because we do feel that community leaders need to be in the forefront, but they also need to believe in the vaccine.
Thank you. We have two questions. We'll start with Dr. Vargas. She has her hand up, if you would unmute and ask your question, then I'll go to another question that's in the chat box.
Thank you so much. And thank you for both of your presentations. And this question is for Dr. Ramirez. So Dr. Ibram X. Kendi from Boston University heads the Anti-Racism Center. And he and his team have a partnership with many states where they have a COVID racial data tracker that has the latest race and ethnicity data from states and territories. And it has beautiful data that has pretty much all of their underrepresented minorities. Have you reached out to them and to do some sort of collaboration with what you're doing?
They're not a specific organization that we've reached out to, but if you can maybe in the chat give me the information, I'll be glad to follow up with them. Yeah,
definitely. They're doing amazing work, but I just feel like with what you're doing and what they're doing, I think this would just help flourish with.
Great, thank you.
Especially with a lot of the issue, what we're experiencing in Texas. So yeah.
Thank you. Thank you. The next question could be either for Dr. Rivas or Dr. Ramirez, and it's really, there was a question about how, they wondered if how college and university can play a role in this process of, communicating out. Are there any successful university community partnerships that are working? Either Dr. Rivas or Dr. Ramirez, any information there?
I'll let Maggie go first. Maggie, you're muted.
You're muted. There you go.
I was going to say, I think that's more of a question for Dr. Ramirez, because we really don't do that. That's not our mission. We are glad to retweet or put on social media messages from other, reputable sources, but that's really not our area.
Okay, no, actually I can. Just last week I was also on another webinar for the Latino students from the Southwest, and they all came together and we had different speakers for them, and so they are very active. So at least from our Latino medical students, this is really hitting home for them, and they have become very active in their own independent ways, through their different academic institutions.
Great, thank you. I do have a question for Dr. Rivas specifically. So your interview subjects, there I would imagine there are those who are either undocumented, right, and fear sort of being, made too public, right? So how do you deal with those folks who might feel that if they say something that might harm them if they're undocumented, or if they talk about a neighbor that has COVID and that could be traced as a pre-existing condition? Have you made any sort of, or how do you protect, I guess, the interview subjects in that way?
Yeah, so we have something called a post-interview. Well, we make it clear, from the beginning, and we get their verbal agreement in our recording, but that's still not enough, because I think sometimes people aren't really thinking in terms of who's going to see these. If you put an interview on YouTube, it's going to be available to everybody. So we do something called a post-interview checklist, and we're required to answer a series of questions about whether they've said anything in the interview. If they are undocumented, they said anything in the interview about their documentation status or health status or someone else's. And so in some cases, what we've done is we will pull out we'll either use a pseudonym for the person or use their, like Tomas L, and use that as kind of instead of their full name. And when we first started, we did an undocumented construction worker who in Phoenix, who wanted to have his name used and wanted us to use, and was really upset with us. But we said, you may not, he says, I think I'm safe. But we didn't feel like he really could understand all the implications. And so we did give him a pseudonym. So we're really careful about that, and something we're very, very mindful about.
I think a follow-on question to that for you as well is so what are you looking for more institutions to partner with, and if so, what would be the benefit to the partners of Vosis of a Pandemic?
We have, we are glad to have other partnerships. It is labor and time intensive, and the partners that are successful have access to either graduate students who can do the interviews or undergraduate interns who can do the interviews. The benefits to them is that if they have not taken on oral history and they want to learn how to do it, like learn it by the book, learn the best practices, it's oral history done right is much more involved than just interviewing someone. There's a whole host of methodological issues that you have to address, and privacy issues, and lots of ethical issues and preservation issues. So it's a chance to dip in with the guidance of an organization that's been doing this for a very, very long time, because oral history does represent a venue, an avenue to doing research on the Latino community that may not be available otherwise. So the advantage is, after you've done your interview and you've recorded your interviews, that doesn't have to be the end of the research. In oral history, the interview recordings that you've made will be available in 10 years and 20 years and 100 years, so that others will be able to mine that interview and use it for something. So I think the multiplier effect of oral history and just creating the primary source materials as part of this is one of the best methodologies that we can use as academics.
Yeah, I'm struck by the whole. I mean, and Maggie, you and I were talking earlier yesterday, something about how, we come from a long line of storytellers, right? And our history, our family traditions are all oral history, rather orally said, and so those stories are handed down through generations. So it's an interesting sort of way of capturing that as research, right? And from a scholarly perspective. Any other questions out there? I was trying to see if the chat had any other questions, comments?
My comment to both Maggie and Amelie is that this work is obviously going to continue. And I think we've asked about how universities and individuals can become involved, and how we can make this much more of a take a much more multidisciplinary approach, because it's not just in the health sector that this is going on, it's going on in other sectors of life in our society. Are most of your teams multidisciplinary teams? I just thinking about the methodology that we've been alluding to. Can you say a little bit more about the teams that you bring together?
Amelie, do you mind if I take this first? Okay, so ours are my interns, and my interns are journalism undergraduates. My graduate students are either journalism or radio, television, film. But we have graduate students in education. We have several from education, and at other universities, most of them are Latino studies or Mexican American studies, and so it really is very interdisciplinary. And oral history in and of itself used to be that it was mostly concentrated in history departments, but I'm in journalism, so I do think that it has applications beyond this. I would love to get, and right now I actually work with a consortium of other researchers, Latina researchers at UT Austin and elsewhere, that are doing research on COVID. And a lot of them come from public health disciplines. So they're using they're working with some of our interviews to kind of tell the story behind the numbers of some of the numbers that they're collecting.
And my team is very diverse as well. We have communication, psychology, public health, medicine, behavioral health, that have come together in terms of in journalism as well. And so it's been just a great opportunity to work with a number of individuals that have come together around this particular health problem. And just last week, I was invited by a professor from Bodine College in Maine, and it was her Spanish class. She was doing Spanish, cultural, and health. And she assigned her students to go into Salud America and break down some of the issues. So she asked me to give a presentation to them. And it was really just fun because they wanted to hear it in Espanol, and then they asked me their questions in Spanish as well. And so it was a fun class to do.
Thank you. And in the chat box, there's a comment by David Perez, and I think it's interesting. I'm really intrigued by the remarks related to oral history. I wonder if the association he might host an institute to advance multidisciplinary approach that Dr. Arredondo referred to. Just saying, I think it's a good suggestion. Any other comments or questions from anyone? Anything? Sergio, that would be amazing. Oral history has been a huge part of our survival within higher education. Sergio, would you be willing to say a little more about that?
Hi, good morning. Well, first of all, thank you so much, doctoras, for your amazing work and for shedding some light and giving wisdom to what's going on. I really appreciate it in this time and space. And I believe that our oral history, right? Our trajectories, our journeys, how we've navigated higher education has been a huge part of our surviving, and then even pushing it forward to thriving, right? Thrival is not a word. I tried to put it in there, and then it kept saying it was wrong. So, but we want to move past surviving into thriving. And I think the oral histories of our experiences and those of, our antepasados, the folks right here doing this amazing work, the doctores before us, are showing us that there's ways to navigate these oppressive spaces, these historically marginalizing spaces. So I think oral history is usually thrown into the backseat as this is just for historians, or this is something that doesn't require IRB, or it doesn't require, rigorous work, but it's rigorous, right? It's beautiful. It's living to a testimonio. It connects to things like Plática methodology as well. So.
And Sergio, you raise a very important point. I mean, sometimes now I just start my conversation and the different presentations. I said, we are the majority minority in the United States. We are now representing 18% of the US population, and we still get marginalized. We still kind of get pushed to the side when different committees, sometimes I'm the only Latina present there. And I'm saying, I can't represent the diversity of our Latino population. I said, we need more, and we really need to push forward on these issues. And I think, the type of work that Dr. Rivas is doing in creating those stories, and again, showing the impact that, for example, that this health issue has had on us is really incredible. I mean, losing a generation, we've lost over 500,000 individuals across the United States due to COVID. And just because people don't want to wear a mask or maintain some of these, we call it physical distancing, not social distancing, behaviors is truly important. And so we all need to be together on this. So thank you for bringing that to our attention.
Thank you, Sergio.
Yes. Any other questions, comments?
There's a comment from Dr. Villarreal in the chat box.
Yeah, we had two students share. Thank you, Patricia. We had two students share with Senator Luz Escamilla, Utah, what they learned about COVID in their communities through oral histories, SLC Guadalupe neighborhood and the Navajo Bluff community. Yes to oral history. So it's just affirming the importance, right? The thumbs up to oral history. I guess that the question I had, and I don't know, how relevant this would be to this, but have you also maybe reached out, I think particularly in the Salud America program, to other communities, marginalized communities who are doing similar work? There's always not only strength in numbers, but strength in sharing knowledge and sharing approaches. I know that the Navajo Nation out of Arizona and Nuevo Mexico have been really, really suffering through COVID in terms of this healthcare disparities, access, the time it takes to get to a hospital from some of their communities. So I was wondering if you had done any connecting to other marginalized communities that are doing sort of similar work.
Yes, we have now a network of over 400 individuals that are really are following us. These are parents, these are teachers, these are researchers, health professionals that have really been following our message to work together and get that out. And the most important part is our work is based on theory, the Albert Bandura theory in terms of increasing self-efficacy and collective efficacy. So we really want to mobilize communities to ask for change. And we create our information in a way that individuals or communities can download it and share it with their city council members, or go take it to the PTA, that they want better foods in their schools for their children. They want more sidewalks in their communities where they can walk and exercise in a safe way. These kinds of things. These are all very specific actions that individuals can take, and what we do is we try to craft that information so that it's easy for them to utilize in their community. And we also, in our oral history, is more the role models. We try to find real individuals in these different communities that have made that change for their community. And really, we call them salud heroes, and we share their stories, and we help package their information so that other communities can replicate it. One of the things that is coming out of this COVID is mental health issues and how it's impacting our children, and how there's a lot of child abuse, domestic abuse going on that's not being reported. So again, we need to unveil some of these issues and make them public and help create better actions to help everybody.
Great, wonderful. Thank you very much for the two of you, both for your insights, your scholarly work, and just the practical application. I think that to me is an important part of the work that you're doing. So I wanted to thank you again for sharing your work, taking the time from your very busy schedules. So just acknowledging that. Thank you very much. Aplauso. Muchas gracias.
Thank you all.
Yes, thank you. So I'm going to hand it over to Patricia Redondo, Dr. Redondo, to take it from here. Thank you very much.
Muchas gracias, Dr. Ramirez y Dr. Rivas-Rodriguez. When the research going on in the moment on COVID is terribly important, as you said. It's not one of these, let's reflect back on what happened. The lived experience is what needs to be captured and shared. And all of us, knowing in our different parts of the country or in our different disciplinary areas, have a way to make contributions and connecting with you. And the point about the oral history really strikes me as one that I think AAHHE can really play a role in bringing to our membership. A lot of our graduate students, our faculty are looking always for other methodologies, I would say, that are really going to capture the voices of people. We're all trained in the quantitative, and we know that that really is not the best way always to authenticate what is going on for the communities we're trying to serve and learn about, and to make some best practices recommendations. So I would say we have a professional development committee within AAHHE, and I would see this as an area that Tomas will give leadership to as we think about opportunities to bring to our membership new ways of conceptualizing research and carrying it out. So thank you for making this such a prominent part of our conversation today. And Tomas is the chair of our professional development committee, so I wasn't just calling him out for no reason at all, but we know he'll be taking this on with the rest of us. It's not a one-person plan. So muchas gracias de nuevo to both of you, and we are going to continue with our program as I introduce two very important people for the AAHHE plans moving forward. We have, as many of you know, a Faculty Fellows program. And the Faculty Fellows program is a space where over the years we've had individuals who are junior professors in particular coming together to receive mentorship, to receive guidance on how to proceed with their academic careers, particularly to tenure. That's the real objective here. A number of people on the board have been in the Faculty Fellows program or the Graduate Fellows, but talking about the Faculty program, Faculty Fellows. This year we took a hiatus. However, we now have two wonderful volunteers, both former Faculty Fellows who are tenured professors, by the way, who will be assuming the role of co-chairs for the program that will ensue for 2022. So this will start in June of 2021, and so we go this year. So I'd like to introduce first Dr. Luis Aguilar Hernandez. He's an associate professor in the College of Education and Integrative Studies at Cal Poly Pomona. There he teaches in ethnic studies and education. His academic trajectory began at Moore Park College, and he transferred to UCLA, where he received all of his degrees. He was trained by Dr. Daniel Sorozano, someone who's familiar to us here at AAHHE, and he learned about critical race theory in education and historical methods. His research and publications include charting 1990 student of color activism in higher education in Southern California in the 1990s, and engaging critical pedagogy in higher education. His most recently published and co-authored manuscript in the Latino Studies Journal is titled Resisting the Death of Diversity, about the formation of the first Chicana Latina Latino Cultural Center at Cal State Pomona. And he also served as co-editor with Dr. Cindy Cruz of a special issue with the Association of Mexican American Educators titled Grounding Emerging Scholarship on Queer, Trans, Chicana, Chicanx, Latina, Latinox Pedagogies. Dr. Aguilar Hernandez was a faculty fellow in 2016 and credits his involvement in the program and the mentorship of Dr. Julie Garcia for his success in being awarded tenure in 2020. So we congratulate you for your tenure and for your willingness to, of course, accept the role of co-chair for the Faculty Fellows program. I'd like to also introduce Dr. Marcela Cuellar. She is an associate professor in the School of Education at the University of California, Davis. And her research focuses her research examines higher education access and equity with a focus on Latino student experiences and outcomes at Hispanic serving institutions. She looks at campus climate and community college baccalaureates. Her research has been published in the American Journal of Education, Community College Review, and the Review of Higher Education and Teachers College Record. Additionally, Dr. Cuellar is originally from Oxnard. She is the proud daughter of Mexican immigrants, and she holds a BA in psychology and Spanish from Stanford and an MA in higher education leadership from the University of San Diego. Her PhD in education is from UCLA. We are also indebted to Marcela, who was a faculty fellow in 2018. Additionally, she has another piece of relationship to AAHHE. She was the first place winner of the 2013 AAHHE ETS Dissertation Award competition. So thank you both to Marcela and to Dr. Cuellar and Dr. Aguilar Hernandez for your commitment to the continuation of the Faculty Fellows Program. Do you have anything, are you on the program here that you want to comment if you're with us in person? Okay, well, we will move now to, oh, there you are, Dr. Aguilar. Do you want to say something?
I'm just really excited to work alongside Marcela Cuellar, and just want to thank Dr. Victor Sainz, Dr. Patricia Perez, and Dr. Aurora for the support. And I'm really looking forward to working and bringing back the Faculty Fellows program to support folks in the tenure track process. So thank you all so much.
Gracias. Yeah, thank you. Dr. Cuellar, are you there?
I don't see her here, Patricia. I believe she'll be joining us for the closing program though.
Okay, muchas gracias, Victor. Thank you. Well, then we will move to the next part of our program, which is a very exciting part, which is the continuation of our awards presentations. On Monday, we made awards to our founders, our first founders award, to the University Faculty Award, and then the Graduate Student Award. So joining us today to present the 6 other awards is Dr. Ed Edith Fernandez, who is also on the AAHHE Board of Directors. She's in her 2nd year with us. Edith is a proven administrative professional skilled in building relationships with community leaders, elected and government officials. She's a tireless advocate for post-secondary education. Edith's career in higher education spans 25 years, working with community colleges and university students from minority-serving institutions. Currently, she's the executive leader. She's a vice president at Nevada State College, the vice president for college and community engagement. Dr. Fernandez is known for her inspiring keynotes, including leadership and development trainings. She is a proud Nevada native and has worked at 3 of the 6 public higher education institutions in Nevada. She received her master's from Harvard University and a PhD from the University of Michigan. Gracias, Edith, for taking the platform and welcoming our awardees.
Thank you, Patricia. It's my great pleasure and privilege to introduce the recipients of our 2021 AAHHE Awards. The awards committee had an honorable task of selecting this year's recipients. You know, the abundance of creativity, intellect, leadership within our Latinx community is a source of pride and inspiration. And I know if we were all together, we would be cheering and giving each other hugs and of course networking. So please use the chat to give your shout outs. Do your claps. This is our ASL applause. Thumbs up. So let's get the energy up in the chat room. This is a very special part of the AAHHE conference. I wish we could all be together. Un gran abrazo to all of you. I'm going to go ahead and jump right into this so we can go to the next slide. To begin, the outstanding support of Latinx issues in higher education is given to an individual in higher education, in the higher education community, who has demonstrated outstanding accomplishments and support of AAHHE's mission. The 2021 recipient of the outstanding support of Latinx issues in higher ed is Dr. Esther Molnix. Dr. Molnix began her professional career in Mexico and was an instructor in 2 higher education institutions, as well as being a clinician. Mulnix has taught at several universities in the United States and abroad. As a vice president of academic affairs at CETIS Universidad in Baja California, Mexico, and vice president of academic affairs and interim president at the American University of Iraq in Sulaymaniyah. For 18 years, Dr. Mulnix has been the editor-in-chief for the Journal of Hispanic Higher Education. And for the past 10 years, Esther has published over 40 scholarly papers in the journal's special edition. These publications have directly contributed to the credentialing and success of many of our AAHHE members along their journey to the tenure. Esther has led one of our most popular and highly rated pre-conference workshops, writing for higher education publications. Esther has provided one-on-one advice to our commissioned authors and has provided relief and motivation during the publication process. AAHHE is grateful for her sustained leadership and remains our publication champion. Please join me in congratulating Dr. Esther Molnix. Woo! Esther, I invite you to say a few words.
Great. Thank you very much, Edith. Well, dear AAHHE executive directors and members of the Hispanic scholarly community of AAHHE, it is my great pleasure to receive this award. I feel humbled by your recognition. It is at times like this that I am reminded of the importance to support and nurture each other. So I thank my family of origin in Mexico, as well as my adult children in the United States. Also the circle of friends that every day and colleagues like yourselves that support me and encourage me and cheer me along so that I can continue on. Finally, and most importantly, I thank my husband and partner, Michael. It was his idea that motivated us to found the Journal of Hispanic Higher Education. He envisioned the possibility of publishing more of the Hispanic scholarly community proceedings. So he also motivated us to join with AAHHE, and we started a journey to go and visit with, at the time, Alfredo de los Santos and Louis Olivas. We met them and our partnership began. This was many years ago. So I just want to say today, un fuerte abrazo y la promesa firme de continuar este trabajo editorial. Unidos siempre. Gracias.
Gracias. Unidos siempre. Thank you. Thank you. All right, let's move on to the William Aguilar Cultural Arts Award. This is given to an individual who has contributed significantly to our understanding of the Latinx community and culture through literary arts, scholarship, and publications. Our 2021 Outstanding Cultural Arts Award recipient is Dr. Javier Avila. Dr. Avila is a celebrated poet, novelist, professor, and public speaker. He has taught for 22 years at Northampton Community College in Pennsylvania. Students refer to Dr. Avila's classroom as a sanctuary of mutual sharing, trust, and understanding, one that inspires students of all backgrounds and that serves as a guidebook on how to live an exceptional life. That is very powerful. He has published 15 books, several of which have won national awards. His one-man show, which stay tuned for, we'll have a special treat and get to see it. His one-man show, The Trouble with My Name, has become a national phenomenon. It never fails to make audiences laugh, cry, and embrace the autobiographical journey of a man who moves between cultures to provide a fascinating perspective of American Latinos who struggle to dispel misconceptions about their identity and place in the world. Please join me in congratulating Dr. Javier Avila.
Right.
Yes, aplauso. Javier, I invite you to say a few words.
All right. Let me see if you can see me now. I am have the award right here with me. Can you see me?
We can see you. Beautiful.
Okay, excellent.
Yes, thank you.
Thank you so much, everybody. It is an honor to be acknowledged. Un gran honor por tanta gente tan bonita que está aquí. When you honor an educator, you honor the future. And I've always said that. So thank you for always thinking of the future of this country, which is beautiful thanks to the contributions of all these wonderful educators from AAHHE. What I do with this show is, in addition to building bridges, I always use the metaphor of building a cathedral. The great cathedrals of our time took generations to build. That means that the people who started working on them did not live to see the finished product. And yet that didn't matter because they knew that they were working on something larger than themselves. So that's what I do with this show, with The Trouble with My Name. That's what I do in the classroom every day. And it is, what we're doing is, estamos sembrando semillas para las próximas generaciones. So thank you so much, AAHHE. Thank you to everyone, Joanne, Patricia, Lucia, and everyone in the wonderful organization. And very shortly, you will have a taste of The Trouble with My Name. It's not going to be the entire show because the entire show is very long, but you're going to have a really nice taste of it. And I'm very excited. So thank you so much. And we'll see you soon.
Thank you, Javier. We look forward to rejoining you as you close our session. All right, let's move on to our next award. This is the Outstanding Community College Award, which is given to an individual with demonstrated excellence in advocacy, teaching, or leadership, and has provided significant contributions to the community college experience. Our 2021 Outstanding Community Award recipient is Dr. William Serrata. Dr. Serrata is currently the president of El Paso Community College, which was recently listed on the Index of Top Community Colleges for Hispanics, and has held this distinction of awarding the most degrees to Latinx students for 16 years in a row. During his career, Dr. Serrata has provided enrollment management leadership and fostering enrollment growth, as well as increases in student retention, dual credit enrollment, and graduation rates. Knowing that over 80% of El Paso Community College students have the goal to attain a baccalaureate degree, Dr. Serrata has set out to develop strong relationships with four-year institutions. I quote, "It's the student's job to make the grades in their courses that allow them to transfer. It's our job to have good relationships with four-year institutions so that we can facilitate their transfer and help them achieve their dreams." His leadership in the areas of workforce and economic development has transformed the El Paso community, and his mentorship of other Latinos reaches nationwide. Please help me congratulate Dr. William Serrata. William, I invite you to say a few words.
Thank you so much, Dr. Fernandez. Thank you for that kind introduction. What an honor for me to receive this award. I'd like to thank Dr. Arredondo, Dr. Saenz, Dr. Canales, and the entire AAHHE board. I'm humbled and honored to accept this award on behalf of the 29,000 plus students that EPCC serves, of which 85+% are Hispanic or Latino. I would like to thank my colleagues at EPCC as well as my wife, Jessica, and our two sons, Nathan and Joshua. And I'd like to close with a phrase, what's past is prologue. If we look at the last recession that began in 2008 and ended right before the pandemic struck, there were about 12 million new jobs created, and over 99% of those jobs went to individuals with degrees who had earned degrees and certificates. As we come out of this pandemic and the depression and recession that it entailed, we must ensure that our Latina population takes advantage of higher education in order to ensure a successful future for our population, our states, and ultimately our nation. I'm humbled and honored to receive this award. Thank you so much.
Thank you, Dr. Serrata. We'll move on to the Early Career Award, which recognizes faculty or staff members who demonstrate a commitment and promise via their actions, research, and service to the Latinx higher education community. Our 2021 Early Career Award recipient is Dr. Sara Rodriguez. Dr. Rodriguez is an associate professor and Director of the Center for Community College Education at Texas A&M University Commerce. As part of the AAHHE Familia, first as an AAHHE Graduate Fellow and then as an AAHHE Faculty Fellow, many of us have witnessed her outstanding development as an emerging scholar. She has actively sought out opportunities to engage her scholarly work within this academic community and is one of our rising stars. Dr. Rodriguez's work focuses on the experiences of Latinx students in higher education, and she has amassed quite an impressive scholarly record with a special emphasis on STEM, intersectional identity experiences, and community colleges. Dr. Rodriguez has authored 53 works as an early career scholar, including 29 peer-reviewed journal articles and numerous book chapters, research briefs, and essays. Dr. Rodriguez has also established a national reputation as a talented grant maker. She has already secured multi-million-dollar federal and private grants to support her research and train doctoral students and postdoctoral scholars. This is a feat that is usually reserved for more senior scholars in the field. Please help me congratulate Dr. Rodriguez. Sara, so great to see you. I invite you to say a few words, and we all get to see your lovely baby, Azelia.
Yeah, so thank you so much. I'm really excited to have won the AAHHE Early Career Award, and I'm joined by my husband and our new baby girl, Azalea Pearl. So I want to start by saying thank you so much to AAHHE, the committee that chose me, and to the AAHHE community that's been so good to me over the years. And I want to say a special thanks to my nominator, Victor Sines. And so he's been a sponsor and mentor and friend and everything for so many years, and I really appreciate it. I also wanted to say thank you to my family, who I know are on. So it's really cool. It's COVID, but yet your family gets to be on. So I'm really excited that they're able to join us. So to my mom, my dad, and all.
Hi Rachel, how are you?
And also to my mentors,
I'm fine. I'm good.
That have been so helpful over the years. Another.
Yeah, he's in daycare.
Someone needs to mute whoever's talking on the phone.
Okay, it was Eric. It's fine. But I want to give a special shout out to my research group. So the Rodriguez research group that I run, this makes this whole early career award possible. So they do a lot of really great work in supporting the work that's here and the publications and everything. And then finally, I want to say thank you to the funders who have been a part of this journey. I couldn't have done it without the Gonzalez Foundation. I was a funded Gates scholar, so a big shout out to them. And then also the National Science Foundation and the Control Center and the Center for Community College, Community Colleges. And last, again, just saying thank you to my husband, just because you can't do this work, you can't do this work at all without having a really good support. Thank you all, and congratulations to everyone listening.
Thank you, thank you. What a treat to see your family. The AAHHE family grows, the next generation, right? With that, let's move on to our next award, which is the AAHHE Graduate Student Award. This award recognizes doctoral students who aspire to join the academy and demonstrate their academic accomplishments and servant leadership at their institution. Our 2021 Graduate Student Award recipient is Angel Gonzalez. As a first-generation queer Joto Latinx scholar, Angel's passion lies in making a difference in their comunidad through education. As a son of immigrant parents, Their familia are the foundation and pillars of their successes. As an aspiring faculty member, Angel recognizes the support, validation, and cariño that numerous femtors and mentors have provided them. Currently, Angel is a doctoral candidate at San Diego State University and serves as a graduate research associate for the American Council on Education. Using a ground theory approach, their dissertation seeks to develop a Latinx leadership model for the experiences of Latinx community college administrators via testimonials and queer chisme sessions. Their research agenda explores experiences and outcomes for minoritized community college students, with an emphasis on LGBTQ+ students, Latinx student identity development at the intersections of queerness and Latinidad, and racial equity policy implementation. Angel's inquiry includes both qualitative and quantitative methods, such as queer phenomenology, testimonial queer chisme, and critical policy analysis. And Angel is also the managing editor for 2 academic journals. Their passion to support the Latinx community is innate to their own lived experience, moving them forward to pave the way para los que siguen. Please help me congratulate Angel Gonzalez. Angel, I invite you to say a few words.
Thank you so much. Gracias so much for this recognition and award. To my papá and mamá, los quiero un chingo. Gracias por todos sus sacrificios para que yo ande aquí. To my nominators, my scholar madrina, Doctora Susana Hernandez, and one of my best friends and chosen family, Futura Doctora Nancy Camarillo, gracias for the energy, love, and care you placed into this nomination, and for your continued support in my journey. Las quiero mucho. To the rest of my mentors, femtors, my chair, Doctora Vasquez, and scholar homies, gracias for the support and chismeria in this process. And of course, shout out to my amazing partner, Dr. Luis Ramos, who supports me and allows me to advance my career, who takes risks with me, and who is there through it all. I love you, amor. This is for all the queer and trans Latinx gente doubting their magic. You matter, you are beautiful, embrace your magia. Thank you, AAHHE Familia, for all that you do and for this award.
Thank you, besos y abrazos. It's been a great honor introducing you to our AAHHE Award recipients, and I will pass it to Patricia to share with you our final award.
Muchas gracias, Edith. Wow, what a great, great number of awardees. I mean, all of our awardees are amazing, and they brought their award as well. I saw that. So muchas gracias to all of you, and we share in your pride because you really make AAHHE what it is, a powerful association for educators, for researchers, for community activists, and the creativity that comes through in the work you're doing, whether you're the publisher at like Dr. Mulnix, or whether you are like Angel Gonzalez, who is creating new spaces for research in the Latinx area and intersectionality and so forth. Anyway, this is all so exciting to hear. And the work that, we've heard from Dr. Rodriguez, your work as a young scholar, and the number of publications, you probably don't get, it's just like this goes on. And we do have to celebrate the work you're all doing. Dr. Serrata and his innovative work at the University of Texas, El Paso. And of course, we're all going to join in with Dr. Aguilar shortly to follow him on the problem with my name, which I happen to follow on Twitter and other places where Dr. Aguilar shows up. So, well, I will now segue to another exciting part of the AAHHE Awards program and invite Dr. Arturo Madrid. I saw you join the call. If you will also join me here on the screen. There you are. Okay. Dr. Madrid, you met on Monday. He was the chair of our awards committee, Book of the Year Awards Committee. And I've asked him to join me today to present these special awards. And I think what I'll do is pass it off to you, Arturo, since we worked on this together and I've had a lot of airtime. So I will invite you to introduce and share some comments about our decision to create Distinguished Authors Awards. Por favor.
Thank you, Patricia. I told Patricia that when she asked me last night if I would join her, I would be honored to her. A mí nunca me faltan palabras, so she could kick the ball over to me. And she just kicked the ball over to me. So I will take the ball and run for it. I will start by saying that it was my great honor almost half a century ago to be tapped to direct one of the most significant programs ever to advance the academic status of Hispanics in higher education, the Ford Foundation Graduate Fellowships Program, which over the course of several decades made awards to hundreds of Chicanas and Chicanos and to Puerto Ricans who wish to pursue doctoral studies leading to an academic career. Out of that program came an extraordinary set of scholars and activists who established and developed fields of study related to the cultural expression and the historical experience of the Hispanic population of the US and the Americas. And by their association with the program and the networking it permitted and fostered, they also established the foundations for a national Hispanic academic community, which reached out to other programs and other students in the same situation. And over the course of the past several decades, have expanded that community exponentially. Not every star in the Hispanic academic firmament was a Ford Foundation grantee. Some had other opportunities, including programs funded by other foundations, by the federal government, by disciplinary associations, and by doctoral granting institutions. Many, despite their stellar records and promise, did not get chosen for the Ford Foundation Award for various and sundry reasons. I'm always pleased, if somewhat abashed, when some such person approaches me and tells me that although not recipients of the award, they had obtained a doctorate and have pursued an academic career. The recipients of this inaugural and groundbreaking award are pioneers in their areas of study and first and second generation significant category of Latino scholars, Latina scholars. Unlike some of us, they didn't simply plant the seeds of their areas of study. They nurtured them and brought them to fruition, by which I mean that they developed fields of inquiry and prepared their successors to further expand their pioneering work. Of equal importance, they did not simply remain in their offices, in the classroom, or in the archives. All became activists. All have been and continue to be part of history, by which I mean that they have figured significantly in the public arena, are public intellectuals, in addition to being scholars, and continue to have an extraordinary praxis, some even in retirement. I'm deeply moved to have been given the opportunity to participate in honoring my very dear friends and colleagues. Some of you may have heard me say in a prior session that it's important to honor heroes before they leave us. With this award, I hope we are in part doing so. Felicidades y gracias, Aida, Carlos, y Michael, por su labor y su compromiso. And what handsome visages you present before us. Back to you, Patricia.
Gracias, Arturo. And we have our authors with us, so I want to make sure that we invite each of you to participate with us. Is Dr. Hurtado with us? She's the only one I didn't see. But let me start then with Dr. Olivas, and just in case she does join us. Dr. Olivas has been here for the program. So Dr. Michael A. Olivas is with the University of Houston Law Center. His book, that was submitted for this particular book competition is titled Perchance to Dream, A Legal and Political History of the DREAM Act and DACA. This exceptional work documents in magnificent fashion the vicissitudes and complications of matters related to the legal status of undocumented youth. It provides the reader with an informative, comprehensive examination of the subject, which have been monitoring and examining and litigating for the length of its existence. Dr. Olivas is a regular at the AAHHE conference. He has been for many years. And I invite him, since we have a few minutes, if you would like to bring some comments to the audience. Dr. Olivas?
Thank you very much, Patricia. And thank you, Arturo, and congratulations to Aida and Carlos. When people say, is he still with us these days? You know, it often has a secondary kind of meaning. And right behind me, I have a balloon from my 70th birthday last week. And so I feel like Kareem Abdul-Jabbar, the great basketball player, who went on what he called the rocking chair tour. As he played his last game in all these NBA cities, they all gave him rocking chairs. Of course, he was retiring at the age of about 38 at the top of the world. As it happens, this is a very small world. Arturo, my cuate from so many years ago, and I are both from families from Tierra Maria, New Mexico. My tia Lita was his 4th grade school teacher in a single room classroom that still exists in Parkview, New Mexico. Carlos and some of his colleagues have recently done some work on one of my ancestors, who was illiterate both in English and in Spanish at the turn of the century. And I understand Carlos is going to continue on that work, and I'm very privileged. My family has taken great pride in our ancestors. I'll also say that whenever I think of this organization, I think of Luis Olivas, who once introduced himself in person back in the days when we had things in person, as my son, notwithstanding the fact that he's 5 years older than I am. And I have to keep asking, is he still with us? Well, it turns out that he is still with us. I've been withholding his allowance, and his mother and I are very concerned that he hasn't taken his meds all the time. I'm very pleased to work with 2 of his graduates from Arizona State who are making a movie of one of my earlier books, Colored Men and Hombres Aquí. That book had a documentary made about it, and I'm very pleased to have drawn attention to that particular case of Hernandez versus Texas, the first civil rights case ever argued in the U.S. Supreme Court by Chicano attorneys. I'm very pleased that we've licensed it for a feature film, of course, starring Jimmy Smits as me because of the eerie resemblance that all of you are no doubt commenting upon. I do want to thank you very much. This is a magnificent honor, and I'm glad to gobble up all the old guy awards. And I want people to ask, is he still with us? Yes, I am. Thank you.
Michael?
Muchas gracias, Michael. I didn't realize you and Arturo share your similar hometowns or close by anyway. I've read his book, so yeah, I know where you're from. Muchas gracias. And it's my great pleasure to welcome Dr. Carlos Velez Ibanez, a colleague from Arizona State University. I had the pleasure of meeting Carlos when I was there, and I think I was welcoming you because you joined us to establish the Department of Transborder Studies, among other great centers at Arizona State. So Dr. Carlos Velez Ibanez has been with the Department of Transborder Studies in its first iteration. His particular book is called Reflections of a Transborder Anthropologist. And I'm not going to say this well. From Netzahualcoyotl to Azatlan. You can probably repeat that better than I can. This magnificent tome provides its readers with an informative and comprehensive summation of your life's work, which has been and continues to be extraordinary. We are thrilled to be able to add our modest recognition and kudos to the many awards and honors of which you have been a recipient. This is a moment of pride for AAHHE, Dr. Vélez Ibáñez, and I invite you to also share your reflections with us.
Muchísimas gracias. Les quiero enseñar este premio precioso. He recibido otros reconocimientos, como ustedes saben, pero nada como esto. Es una belleza, de veras. Muchísimas gracias a todos. I wanted to say that towards our end of our careers, as Michael has pointed out, I feel sometimes it's like the extinguishing award rather than distinguishing award. But le seguimos jalando as always, Michael, as you well know. But frankly, I couldn't be here at this point in my life and my career if it weren't for, in fact, the support of a single individual who's present here, and that's Arturo Madrid. Because in fact, Arturo, in fact, provided me with the support that I needed as a developing anthropologist, and in fact, he was responsible for my really being introduced to Ciudad Nezahualcóyotl, which was my first field site, and then with another summer after that, and then with, as a matter of fact, 2 Ford fellowships that followed from that. So, otra vez, Arturo, sin ti, ya sabes que no pudiera estar aquí. That and the GI Bill between the two. And I need to certainly thank Luis Olivas, who's always been present and whose leadership in AAHHE has been absolutely stellar. And hopefully I continue to have that wonderful relationship with him. And Patricia, otra vez, fue un placer de reconocerte otra vez después de muchos años de separación. Entonces, a todos ustedes les doy mil gracias. Thank you very much from the bottom of my heart. And I thank you. And now I have to leave you because I have a class in exactly 10 minutes.
Felicidades.
Gracias. Muchas gracias. And we're sorry that Dr. Hurtado is not with us, but her book is phenomenal. Her book, which is on the intersectionality of feminist, Chicanas. I want to make sure I get the title correct because I have it here because I was going to introduce her. I have learned so much by reading her book and becoming more aware of the deep history of Chicana feminism. So I salute her, I salute the book titled Intersectional Chicana Feminisms, Sitios y Lenguas. So I highly encourage anyone who wants to learn more about Chicana feminism, this is required reading. Okay? Great histories, again, talking about oral history, narratives. These are the narratives that we all need to learn from. So felicidades a mis colegas. And with that, Arturo, muchas gracias, Dr. Madrid, for joining me on this year's Book of the Year Award journey. Bien hecho.
Felicidades.
Y felicidades. I'm going to move to my last set of comments before I return the podium to Victor Saenz. On day one, we talked about the outgoing AAHHE Board of Directors, and we just kind of had it as a slide that flew by among other slides. So I just want to take a couple of minutes to acknowledge the outgoing members of the Board of Directors. I'll start with Luis Olivas, who's one of the co-founders of AAHHE, who has served on the board for the last 15 to 16 years. And he has, again, been one of the brainchilds for the conference and for bringing it together with a whole host of conference committees over the years and a number of the programs that we all relish today within AAHHE. It's been one of those take a village opportunities. I'll go next to Dr. Jaime Chain, who also was with AAHHE as a founding member. When I asked Jaime last night, how many years? He said, 15 years. And then I was with the other organization that we spun away from and started AAHHE. So Jaime is been the treasurer of AAHHE, as well as a big liaison when we started the New Leadership Academy at the University of Michigan. So we have a lot of ways that he has contributed to the evolution of AAHHE. Jim Estrada has been with the board for 7 years, and he was involved with a lot of the marketing and public relations efforts of AAHHE, trying to bring some partnerships to us, trying to also enhance the way we market ourselves and we show up in other spaces. So Jim has been a great ally this past year as we looked at new opportunities for marketing. And the last individual rotating off the board is Dr. Joanne Canales. Joanne is in her 8th year on the board. Tremendous. She is the first chair of the board of directors, which again was something new for AAHHE about 3 years ago. So she's our inaugural chair. And fortunately enough that we've had this kind of transition the last couple of years, and Joanne and Victor and I have stayed in our roles for 2 years. So we continue to make the kinds of transformations for AAHHE. Joanne has been this year in charge of the awards committee. She's also been working with Victor on the bylaws and the new committee structure for AAHHE, and bringing all of her experiences as a university administrator to AAHHE's structure and enhancements moving forward. So we are going to continue to work together through the end of June as a board. And so glad that Joanne is going to be part of that period of time. So we thank you profoundly, Joanne, for all the work you've done for AAHHE, for the leadership, and for the conference. So gracias a todos. And with that, I am going to send it back to Victor Sáenz for the closing program.
Well, thank you very much, Patricia. And once again, kudos to all the award winners this afternoon. And of course, also our outgoing board members. Muchas gracias por todos los años de servir esta organización. We would not be here without the amazing work of all of these colleagues, mentors, friends, and trailblazers for our community. And actually, we're going to have a 5-minute break here because we're going to have one more set of concurrent sessions before we come back at 2:45 Eastern time for the closing session. So there's still one more set of concurrent sessions that I invite all of you to please participate and engage in. They will be expecting all of us to join. And then come back at 2:45 for a very special presentation and performance by Dr. Javier Avila, one of the award winners for this year's AAHHE conference, the William Aguilar Cultural Arts Award winner. And I know he teased it earlier, so I invite you for a very, very special presentation from him. And then we will wrap up with just a few last accolades and thank yous. I'll be joined by our incoming conference chair for 2022. We got to keep things moving. And that's La Doctora Nancy Acevedo, who will be joining me to finish us up and close the session officially. So see you all in a few minutes in the breakout sessions, and we'll see you back here in about 45, 50 minutes for our closing session. Thank you very much.